and welcome to this live update on the 7th day of January. Well, yes, we are very close to the PBD, which is always on the 9th of January, but we will have a little bit on that tomorrow. But today we are going to be looking at the situation right here in Queensland, which is a bit of a debacle. And good morning and welcome everyone to the show. Well, when we look at Queensland, many people are saying that our borders should not have been opened this quickly, and so there's lots of debates that's happening that now we have to deal with it, and not only deal with it, live with the condition that we have at this point in time. And as we know, our system here is quite overwhelmed. So should or should not have it been open? Queensland COVID-19 testing data getting weaker every day will impact hospital services. Chaos surrounding Queensland's COVID-19 testing systems has an expert worried. The data on infection rates during the Omicron wave is so grossly underreported, it is almost impossible to make predictions about the future impacts in the hospital. And that is quite true. It is under enormous pressure. Infectious disease physician Paul Griffin said he was surprised that 2 years into pandemic, Queensland still had no process to allow residents to record their rapid antigen test, the RAT results, which would give health authorities information about emerging clusters and super spreader events. We know about many things happening in the community, and those things really need to be addressed. Chief Health Officer John Gerard has acknowledged the official stats are a gross underestimate of the true numbers. There are many people with COVID at home, no one knows. To take the strain of testing clinics, National Cabinet this week ruled that positive, meaning RAT results, would not be needed to be backed up by a laboratory test to confirm a COVID-19 infection. So, that's what the National Cabinet agreed upon, but what's happening here? But at this stage, Queensland has no way of tracking the results of RATs, meaning no COVID-19 cases are going unreported. RATs also been hard to find, and COVID-19 testing clinics are so overwhelmed that some Queenslanders with symptoms have given up getting testing, opting to stay at home and isolate for 7 days. Well, that is quite true. We know about people in the community who are aware or have symptoms but are finding it very hard to even find a place where they can go and get tested. Queensland Health Minister Yvette Dart said her department was working on a system that would allow residents to easily notify authorities of their RAT results, but her preference was for a national solution rather than a state solution. A national solution is what Yvette Dart is calling out for. That will help us model and understand the growth of the virus in the community and the likely hospitalization rate. I think it's really important, Ms. Dart said. Of course it is important. It is very, very important because people doing those tests at home are not reported. We don't want to take our eye off the ball as far as having an idea of the volume of virus spreading through the community. So, and it is quite rampant out there. Fears that health data getting weaker every day. Dr. Griffin, an associate professor at the University of Queensland, said he feared the quality of the data being relied on to make health decisions during the pandemic was getting weaker and weaker every day. Not the cases, but the data is getting weaker, the data based upon what the decisions are being made. So what do we need to do? We need to do more to monitor so we know how many cases are out there. We know where the bulk of the transmission are occurring, and to monitor our healthcare resources so that we can make sure that we don't get overwhelmed, Dr. Griffin said, but I think it is already happening. At the moment, there's not a clear plan for that. We didn't know we'd be relying so heavily on rapid antigen tests right now as we are because we didn't anticipate the overburdening of the laboratories. testing is getting very, very hard, and we know there are cases out in the community, even in childcare places as well. But we always knew we were going to use them at some point. Well, of course, we were going to use them at some point. I think there should have been a system already to deal with the results from these tests. I totally agree with that. Why this hasn't already been a button on our check-in app, for example, is just beyond me. With the app, you could report back to the authorities, and that way the correct numbers would have been monitored. But a call to reintroduce density limits, Queensland yesterday recorded 10,332 new cases. The virus that causes COVID-19, taking the state's total number of confirmed infections during the pandemic to 46,731. Wow, that's a big number. And Dr. Jared has said that hospital admission for COVID-19 during this Omicron wave would peak in the thousands, but not in the tens of thousands. Even peaking in thousands is a big number, Dr. Jared. The number of patients in hospital wards with COVID-19 is increasing steadily, he said on Thursday. And it is, of course, it's expected that in the next 2 or 3 weeks to increase substantially, and hospitals are now preparing. We are going to be stepping up a major emergency in the coming 2 or 3 weeks. Well, that's not good enough. What about if people need to get the test now? Of the 284 COVID-19 patients in hospital, 12 are in intensive care, with data showing people in their 20s and 30s making up more than 57% of the state's known cases of the pandemic virus, Dr. Griffin said. People have been waiting for a long, long time, as Amit has just messaged that it's been, waiting in queue for over 6 hours. Queenslanders are called to consider reintroducing density limits at indoor venues such as pubs, clubs and restaurants in the short term to dampen the transmission. So when we look at dampening the transmission, look at what really happened on New Year's Eve. No one needed any passes or any checks to go and watch those fireworks. So, that was completely. So the testing data, which is, now become very, very weak as well. And so there is such a chaos that is surrounding Queensland's COVID-19 testing system. And it is very, very hard. And we know that, coming towards the end of January, early February is when the numbers have been predicted to peak. So what is really, really going to happen by that time, when our hospital systems are overwhelmed? Right now, if you try and go online to book and test, even there's some clinics, I tried this morning just to see what was happening. Tried few clinics just to see if they were, taking bookings. Tried 1 or 2 in and around here, even as far as up to Nanda. No, so next appointment available 6 weeks from now. So if you need a test now, who is going to wait for 6 weeks? It is just a complete mismanagement. And of course, people needed to be together during the holidays, but I think, and as if you go on social media, you'll see lots of commentary on that. Many people are commenting that, there was no need just to open the border. Maybe the election might have something to do with it, gaining the popularity might have another thing, but, we were in a far better condition pre our festive season break than what we are in now. And if we were going to do what we did to open up, that's fine. If you decided to open up, you had to make sure that the system was in place to get these tests done. If people needed to get the test done, they should be able to go to a place and get the test done and not have to wait in line for 6 hours. That is just ridiculous. And of course, if you try and book somewhere, it is ridiculous, ridiculously wrong. And many places are taking only booked only appointments, and the next booking is available, say, 6 months down the track. So, the system that they said they would be working on to make sure that it will allow residents to easily notify authorities, but the preference still was, as I mentioned before, for a national approach. So, A national approach in the very beginning would have been a wonderful way to go, when the whole of the country would have been in this together. Then all this, model that would have understood the growth of the virus in the community and the likely hospitalization rate, it is really important. So we don't want to take our eye off the ball as far as having an idea of the volume of virus spreading through the community. And at the moment, the data is not correct. It is underreported. Many people are not reporting those. So fears that the health data is getting weaker every day, as I mentioned before. And Dr. Griffin has also highlighted his concern about the availability of the data, and of course the validity of the data as well, because lots of cases are not being reported. We do need to monitor, so we know how many cases are out there. We know where the bulk of the transmission are occurring, and monitor our health care resources. And that is very important. That is done. But it has not been. So what can we do to make sure that we don't get overwhelmed? Well, what can we do? At the moment, there's not a clearer plan for that. There is no plan. It is a management on a day-to-day basis. Plans, policies are being made on the go, on the fly. We didn't know we'd be relying so heavily on the RIT test right now as we are, because we didn't anticipate the overburdening of the laboratories, but we always knew we were going to use them at some point. Of course we were. And I think there should have been a better system ready in place to deal with this. So, I mean, if you consequences, you have to face the consequences. If you're going to open up those borders, you had to make sure that you had a plan to deal with what is happening right now. So there is a call to reintroduce density limits, and of course we know there are many functions and events that have now been cancelled or postponed, and this is going to be happening right through the weekend and everything. There's so much that had been on plan, but it was mainly during those New Year's Eve, New Year parties and getting together. Even at the South Bank, the number of people that got together, and if you looked at the conditions that were allowed to, under which people were allowed to come there, they were coming willy-nilly. There was no kind of tense. The only thing needed was you go in, do the check-in app, and in you go. So at the moment, the number of patients in hospital wards with COVID-19 is increasing steadily. And that as per the report from yesterday. So it is expected that in the next 2 or 3 weeks, as I said before in my report, the numbers are going to increase substantially. And hospitals are now preparing. So we are going to be stepping up to a major emergency in the coming 2 or 3 weeks. And mark my words, that is going to happen as it is happening. Out of the 284 COVID-19 patients in hospital, 12 are in intensive care. So with data showing people in their 20s and 30s make up more than 57% of the state's known cases of the pandemic virus. Once again, Dr. Griffin has called upon Queensland Government to consider reintroducing the density limits at indoor venues such as pubs, clubs and restaurants in the short term to dampen the transmission. And that should have been done in the first place as well. And the masks should have been mandatory. We certainly don't want to overreact, but we also don't want to be too slow to reintroduce some of the basic measures if we think they're required, he said. Of course it is going to be required. Just see what's happening out in the community. We get a lot of reports. We know of people out there who have been close contacts. We'll still see lots of cases and we'll see things continue to progress, but just to slow it down so we can maintain healthcare capacity, of course we need to be able to maintain. People in 20s make up 40% of the known cases. So from midnight, Victoria reintroduced indoor density limits of 1 person per 2 square meter at hospitality and entertainment venues. So we will need to follow suit. Victoria has also made it mandatory to report a positive RAT to that state's health department. Again, It is mandatory. Whether people do it or not is another thing, because if you leave it up to the people, it should have been built into the system, as was said before. Well, right here in Queensland, more than 18,000 people in their 20s have tested positive to the SARS-CoV-2, which was almost 40% of known cases in the state. Dr. Griffin also called for more public health messages to inform young people of high-risk activities during these intense periods of SARS-CoV-2 transmission, which is to encourage outdoor gatherings rather than high-risk indoor activities such as night clubbing. When the RAT, the rapid antigen testing, is readily available, we would also encourage people to test themselves before attending high-risk venues. Well, my thing is, unless absolutely necessary, do not go and attend high-risk or high-density, functions and events. Put it on hold for a little while. Perfect breeding ground, Jessica Tatham, 22, tested positive on a rapid antigen test on Tuesday after developing a sore throat 2 or 3 days after having dinner and hitting a few bars in Brisbane on New Year's Eve. So there you go. Around that time is when we saw the surge. And of course, looking at the conditions under which people were allowed to attend the fireworks display in South Bank was just appalling. It was highly aware that the risk was there. And she said she was aware of the risk he was taking. When you are going out, you sit at tables with people, your friend goes out and gets a drink and brings it back to your table, and these kind of things happen. I think going to bars and everything was the perfect breeding ground. And of course, that is, several of our friends have also tested positive. I know of people very close to us who went to parties and have now tested positive. Even 2 weeks ago, if someone had COVID, it was like, oh my God, that's so crazy. But right now, people are taking a more casual approach, and that is a danger. It should not be a casual approach. Now that more of my friends have got it, it's almost like expected. It's more like checking in. How severe is it? Is it likely slowly, one by one, like the soldiers are going down? So, it is a grim situation. With the first year of her 20s consumed by pandemic, travel being off the table, and her professional career conduct remotely, she says many in her age group are more inclined to take the risk of socializing. So, if you are in that age group, you're used to going out, this is your chance, your life has been taken away, meaning your life in the meanings of what you would do in your spare time. So we want to be able to enjoy our 20s, which is the time everyone tells you to enjoy. The biggest fear is passing it on to grandparents. You want to do the right thing, but it is really, really hard. People want to be together with their loved ones. So, at the moment, people are very, very drained. Energy just drained away. Also, Ebony Granville, who says in her 20s, suspects she has the virus, but has been unable to source a rapid antigen test to confirm. And this is the situation with many people who believe they have the virus or have been in close contact with someone they now have been, but the difficulty is trying to get to a clinic or trying to get the RAT. So that is a very, very grim situation that we are in. So, ladies and gentlemen, there we are. That is the situation right here in Queensland at this point in time. And here's a report on what the hospitals are doing and how they're bracing up.
Handing out water, but not rapid tests. As people queued for PCR swabs in the Townsville heat, news came that only a fraction of Queensland's rapid antigen order had arrived.
We were expecting 500,000 tests in the next few days. Unfortunately, the distributor has said that they're only releasing the 150,000 to us at the moment.
Some take-home testing kits were provided in Brisbane in the hope of relieving the pressure on clinics. Despite National Cabinet's decision to scrap some testing requirements, demand remains high.
We can't go to work until we show a negative test, and we can't get the government COVID disaster payment unless we have a positive test.
We want to get tested, and it's like a moral conundrum, I guess. Like, we want to get tested and do the right thing.
More than 10,000 new positive cases have been recorded in Queensland, but that doesn't include any rapid test results.
Of course, we know this is a gross underestimate of the true number.
The virus continues to spread into new areas, with confirmed cases in the Indigenous communities of Hopevale and Wudjil Wudjil in the far north. There are 284 people in hospital being treated for COVID, but that figure is expected to rise dramatically in the next few weeks.
The number will be in the thousands in Queensland.
The state's hospitals are now preparing for that surge in patient numbers. Staff will be redeployed and some elective surgery will be postponed to free up beds and resources for COVID cases. The fever clinic at the Royal Brisbane and Women's Hospital is closing to allow staff to focus on inpatients.
To all of my colleagues, we're going to be stepping up to a very major emergency in the coming 2 to 3 weeks.
But Queenslanders are being urged to remain calm as supermarket shelves are again stripped of some essentials. A throwback to the start of the pandemic, which still has a long way to run. Melinda?
Yes, we still have a long way to run, and that is the case. All the supermarket shelves are being stripped off. There's panic out in the community. There is confusion out there. People are trying to do the right thing, as you saw by that the young boys. They said he wants to do the right thing, but you can't because who is going to have time to wait 6-7 hours in a queue? People are queuing up, and there are people who are ill, but they are still in those queues trying to get to the test. People want to do the right thing. This is a complete debacle. Just look at those queues.
A strain that is less severe but more contagious. And as a result, we are dealing with much higher levels of cases, which is why we're having to change the testing arrangements, the isolation arrangements. And so we need to ensure that we are focusing those testing resources on the essential tests that are required, not the casual tests.
The result of the surge in cases is a radical overhaul of the testing system, designed to remove some of the structural forces driving long PCR testing queues. PCR test requirements for returning expats, interstate travellers, truck drivers and hospital patients will be removed or replaced with rapid tests. Even sick people and confirmed close contacts showing up at testing centres will be triaged, some to be given rapid antigen tests by nurses on arrival and others given kits to take home.
These point-of-care tests can also be administered at testing sites themselves. So you will find yourself in the course of the next couple of weeks, they'll be transitioning where you'll be either be getting a rapid antigen test provided at that site and you'll get your result there and then, within 15 minutes. You won't have to wait for the test results to come back from the lab.
The shift to rapid tests, at least for now, means that we risk losing track of just how many confirmed cases of the disease are emerging, as there is no simple system in place yet for people to register their test results.
Without confirming positive rapid tests, how will Australia keep track of case numbers, or are they effectively redundant now?
Yeah, states are now working on a process for reporting where they move to rapid antigen tests, which are being done at home. But as I said yesterday, the most important call to make is to your doctor. Case numbers are less the issue. It's connecting to care that is the issue, and the Commonwealth provides the telehealth support for people to be able to do that and to get advice on how they can manage their infection at home.
Of course, that throws pressures back on the GP network rather than hospitals to provide a lot of health care when many Australians don't have a regular GP. Several states, Victoria, South Australia and Queensland, have this afternoon announced people will be required to report the results of their rapid antigen tests from as early as tomorrow. The states are now in the process of importing millions of rapid antigen tests to be distributed for free through testing hubs. Concession card holders will be able to access up to 10 free tests over 3 months through pharmacies. But the global shortage of the tests means there will be a shortage of supply to purchase in shops for some weeks. Anti-hoarding and price gouging provisions are being put in place for when more tests arrive in the country that will ban selling them for more than a 20% profit.
They should only be getting those tests there if they are not symptomatic and they are not close contact. If you're symptomatic and a close contact, you can go to the testing centre as many times as you need to. All of those tests are free.
The focus on the provision of free tests overshadowed other huge changes to COVID rules agreed at yesterday's meeting. Most significantly, changes aimed at getting critical workers in areas from aged care to transport back to work faster, with an obvious risk that they may still be ill.
We'll be able to get aged care workers back to work more quickly, and also for healthcare workers by changing the isolation arrangements. We'll be over the next week working on how we can extend and those arrangements to what we would define as critical workforces.
The government also plans to clarify workplace health and safety laws to make clear employers do not have to impose testing requirements on workers. This removes yet another hurdle to businesses being obliged to close or furlough workers who might be ill. Millions of children returning to school, just as daily case numbers are expected to peak at the end of the month, looms as another crunch point.
What we want to achieve is that those schools and the kids go back and stay back.
The Prime Minister says his departmental secretary, Phil Gaetjens, is developing a framework that will allow students to return to school and stay open. It will be presented to National Cabinet next week.
Be presented to National Cabinet next week, and we'll see what happens out there. Well, of course, now that we're going to be moving away from the PCR and rely more on the RIT test, the doctors have actually raised their concern about that.
With PCR testing overwhelmed in many states, National Cabinet decided yesterday rapid antigen tests would be sufficient to confirm positive cases.
That will take pressure off PCR testing lines.
But there's no system for collecting positive results from at-home testing kits.
If we're going to get a handle on this wave and understand where it's growing and have a proper response and keep our healthcare system safe, we need a system that records rapid tests.
The Prime Minister says it's not an immediate issue given the shortage of rapid tests.
They'll be predominantly still be doing PCR tests, and that will ensure that those test results are going back into the system.
But even when more rapid tests arrive, Scott Morrison isn't too worried about undercounting.
Case numbers are less the issue. It's connecting to care that is the issue.
The states and territories are looking at how to best collect the data, and there are markedly different approaches. In Victoria, it will be mandatory from tomorrow to report a positive rapid test result to the State Health Department. But in Queensland...
If you are perfectly well and you've got a positive result, don't race to get on the phones and flood our 134 COVID number.
And in the ACT, they're sticking with the original system for now.
We're still asking people to please get that rapid antigen test confirmed with a PCR if you can.
And the New South Wales government hasn't said anything about it.
The government still needs to be aware where those cases are popping up so that resources can be deployed.
Knowing the true rate of infection means the hospitalisation and death rates can be accurately calculated and the spread of the virus tracked.
If we all go the Victorian route and make the rapid antigen test results mandatory reporting, then we'll have a much, much better idea of what's happening out there.
But the Prime Minister says health authorities are already accounting for missing data.
Case numbers will be underestimated in Australia because we know that people are self-managing in many instances.
The Prime Minister said he didn't want to impose a national system on the states and territories. But another way to describe it would be that National Cabinet couldn't agree on one. With different experiences of COVID across the country, premiers and chief ministers are each going their own way. Melissa Clark, ABC News, Canberra.
So therein lies the danger when premiers and state heads are going their own way rather than following that national approach. And as I said in my lead story was that there are so many cases out there which are underreported, not reported. People are at home, they have symptoms, and some of them are confirmed, but even then they cannot go and get the retest done. They're just trying to ride it out as per this report.
Australians have spent much of the past 2 years inside their homes. Now it's the most likely place many will see out the latest COVID surge.
We have no choice but to ride the wave. What's the alternative?
It's been a bad few years.
The highs and lows of the pandemic have provided plenty of material for comedian Paul McDermott. He tested positive for the virus in the week before Christmas.
Now that I've had COVID, I'll be able to write and sing some songs about that experience as well. But it's a dark comedy.
Paul says despite being double vaccinated, he and his family were hit hard by the symptoms.
It can be a bit of a shock that it's as aggressive as it is. So I think it'd be good that people are aware of that. The sore throat, the burning eyes, very foggy brain, lethargy and tiredness were probably the overwhelming aspects of it, and not being able to think coherently.
Doctors advise being prepared for the possibility of a positive test by stocking up with painkillers and energy drinks, as well as 2 weeks' supply of any prescription medications. It's also recommended to discuss an isolation plan with family and friends.
Most people who are young, who are healthy, who get COVID at the moment, who get Omicron at the moment, are going to have a mild illness that they can deal with at home. And the important things to do are make sure you keep well hydrated, that you rest a lot, and you take paracetamol, Panadol for your fevers. And of course, if you deteriorate in any way, let someone know.
Infectious diseases expert at the ANU, Sanjaya Senanayake, says it's important to reach out for medical support or even call an ambulance if symptoms escalate.
So if people are getting increasingly short of breath, they're getting severe chest pains, they're getting intractable fevers, they can't eat and drink because of nausea, vomiting, diarrhoea, or they're feeling dizzy, those are red flags that they need to contact someone.
National Cabinet yesterday dropped the requirement for a lab test to confirm a positive rapid result. The Prime Minister instead urged people to call their GP to tell them they're COVID positive.
People who have COVID should contact their GP. They should let them know.
But GPs say they are already inundated with patients while also administering booster shots and working through the details of the new testing system.
We are at risk of overwhelming all of the health system, and many practices are having to enact their disaster plans. I've heard one practice owner told me they had 1,000 phone calls in 1 hour.
It comes on so fast. Within 2 hours, I went from feeling relatively normal to lying on the couch under a blanket on a day that was over 30 degrees.
On Victoria's Mornington Peninsula, Bridget Nile is isolating after testing positive over New Year's. Her husband and daughter have been dropping off supplies.
Didn't have the strength, couldn't sit up, couldn't possibly go to the hospital to have a PCR test.
Bridget has taken a photo of her positive rapid test, but remains concerned she's not officially counted as a COVID case.
It also means that my medical record doesn't show any proof that I have in fact got COVID. So I'm wondering what that will do to my medical records in terms of vaccines, my immunity, and any long COVID effects that I wish to monitor.
You must report your result to the NHS via gov.uk.
In the UK, people have been told to notify health authorities of their rapid test results online.
This allows the NHS to monitor the spread of the virus.
Today, the Victorian government announced plans for a register to record rapid results. Scott Morrison says he's confident other states and territories will do the same in coming weeks.
With the move to rapid testing and the fact there's no way to record those results, well, not if you're doing it at home and not calling your doctor.
Well, that's a way.
But if you're not doing that, you're just self-managing at home. I've got a rapid.
People are doing that now. What matters is how many people are in hospital, ICU and on ventilators. That's the real measure of what the impact is. The real issue is that people are connected to care. That's what I'm concerned about. I want to make sure if someone has COVID that they are connected to the care and supports that are available, including the pandemic leave payments. so they can access those.
We aren't clear on the infrastructure required, and we are currently working with the government to try and work this through, but it's kind of a backwards way. We are going to have to rely on people being honest regarding that, because it's very difficult to verify whose test is who if it's not performed in front of a healthcare provider.
As the world confronts an Omicron surge, some experts say there is cause for optimism.
So having Omicron now, when we've been well vaccinated in the Australian population, is, I guess, as good a time as any to get it. It certainly would have been better than getting it back in 2020.
So they are up to date on Australian Indian Radio, and as the doctor there said that you do the right thing and contact your GP and go to and get yourself tested. And from the other reports which we've seen, that people are trying to do the right thing, they're trying to reach out, they're trying to get the test done, but there are queues and wait for up to 6 hours. That is ridiculous. So the system is overwhelmed, and I think we have brought it upon ourselves as well. That's my personal point of view, that it could have been better managed. Well, so we've had a good look at what's happening, especially in Queensland and of course nationally as well. Right now, let's take a look at what's happening overseas.
A new year, a new record.
We're experiencing the fastest growth in COVID cases we've ever known.
In the last week of 2021, 1 in 15 people in the UK had the virus. In London, it was 1 in 10. But it's not just the surge in cases that's causing concern.
Potentially of greatest concern, case rates are now rising rapidly among the older and more vulnerable, including doubling every week among those over 60.
British hospitals are under intense pressure. Not only are admissions increasing, staff numbers are dwindling, with many in isolation.
I think what will probably happen is it will keep rising, but it will peak fairly soon, and our hope is that this lasts for more weeks rather than months.
The testing system is also under strain, but it's hoped a change, like the one made in Australia, could help alleviate the pressure. People who now return a positive rapid test won't need a follow-up PCR to begin isolation. But unlike in Australia, this rule only applies if you're asymptomatic. Across the Channel in France, daily cases have soared to more than 330,000.
Infection records keep getting broken. This supersonic rise in new cases will keep going for several days, potentially weeks.
President Emmanuel Macron has angered some, saying he wants to piss off those who aren't vaccinated and make life harder for them.
He went a bit too far. The unvaccinated are being cast aside.
He's right. Those who are against the vaccine should understand the dangers.
Experts warn there's no sign of cases diminishing anytime soon. It's hoped the president's policies will motivate rather than alienate French citizens. Steve Kinane, ABC News.
So there you are, ladies and gentlemen, up to date on Australian Indian Radio. So, just going on my lead story for today was that, yes, more tests need to be done, but there is problem getting to a testing station and the long queues. That is a big problem. If you try and go and book one now online, you'll get one for about 6 weeks down the track. By that time, this is all gone. Number two, the rapid antigen testing is not reported, it's underreported, and so there are many people, even in the community, living with COVID-19, dealing with it like that, self-isolating, but it's not recorded, and so the numbers are not correct. And the system is unable to cope up with. On the other hand, people and small businesses are facing another challenge of not being able to fill in the positions that they need to keep those businesses running. So it is a grim situation and could have been better managed, as I said before. And of course, opening up the borders and those festivities and New Year's Eve and all the celebrations, the fireworks, is of course part of life and it needs to go on. But, if we did that, so we now have to face the consequences and we should have been better prepared. So the symptoms are, if you have a sore throat, if you cannot think clearly, or if when you're trying to focus, you doze off, or if you're feeling extra tired, or if you're feeling cold, like that lady said, in a 30 degrees day, she was sleeping with a blanket on. So these are the signs. But even if you have the signs, what recourse do you have? You can't even go to a hospital. You can call up your GP, and the GPs are saying, don't call us. We are overwhelmed with the calls there as well. So, there does not seem to be very, very clear positive outcome or results moving forward on what you can do. The numbers have been predicted to increase. Hospitals are bracing up for the situation to try and cope up with that. People with elective surgery have been asked to postpone that to make the beds available for COVID-19 patients. So that, ladies and gentlemen, is the situation of today. So we will keep you up to date, and we will follow. Of course, the testing needs to be done, yes, but what are the provisions? So there has to be more provision made. People, should be able to go to these places, get the test done. Well, maybe an hour's wait is okay, but waiting up to 6 hours. Some people have waited all day, but by the time their time comes up, they've been told, of course, they're closing for the day, because then they have to process those, upload all the information into the computers and other things as well. So there you are, ladies and gentlemen, up to date on Australian Indian Radio. Until tomorrow, when we do the weekend roundup, it's goodbye from me.